No one wants to go to the hospital, but MetroHealth is working to make any patient's medical experience the best and the most comfortable it can be. How do they do that? Dr. Sarah Lasky has joined us in MetroHealth studio to tell us. Dr. Lasky is Vice President and Chief Patient Experience Officer at MetroHealth. Welcome to the show.
Thank you.
So what we're talking about at MetroHealth is patient-centered care. What exactly does that mean?
What we're working towards at Metro and what we've been working towards for the past few years is really putting the patient and what happens with the patient at the center of what we do and all the decisions that we make. So we are focusing on process improvement and thinking about the patient when we are designing process and when we are making decisions and creating experiences.
Okay, so what does that actually look like? You know, how do you put that into practice?
Well, we've done a lot of different things. So we have created a patient and family advisory council. We are doing training around the patient and patient experience. We are doing communication training. We are doing really teaching that patients' perception of their care is critical, and that can be different for every patient. And
perception is reality, right?
Perception can be reality, and that is really important.
Do you have some examples for us?
Absolutely. So a really good example of how we've changed how we're taking care of patients is when we started, we didn't have a visitation policy. Or we didn't have an overnight visitation policy. And once we had our patient and family advisory group in place, we started to look at how important it is for patients to have somebody from their family with them overnight. And so we talked to the nurses, we talked to the providers, and with the help of patients and families, we have now convinced and changed that policy so that every patient can have a caregiver with them all the way through. And we're opening our new critical care pavilion with a place for a family member or someone important to every patient with them all the way through the night.
That's definitely patient-centered.
It's very patient-centered.
Do you have committees that these people help advise as well?
We do. So we have, our patient and family advisory group has almost 65 members on it, and they sit on advisory groups throughout the hospital, ethics committees, they are on subcommittees of our board of trustees, they are on advisory groups that are making changes everywhere from the OR to OBGYN throughout the entire hospital.
So how does the input come from the patients, like surveys and things like that?
Well, patients do fill out surveys, and we are also, so the patients fill out surveys after they are in the hospital, and so we encourage every patient to fill out that survey because that feedback is very important to us. And we are also embarking on what we are calling transparency. And so the transparency, we are posting our reviews and ratings online on our website. Reviews and ratings can be difficult and challenging, as it can be hard for anyone to be reviewed, but it's really important that the voice of the patient is heard, because that can both change behavior and change how we do things. Luckily, most of our reviews and ratings are incredibly positive.
That's great.
But we look at everything. We look at everything that our patient says. The voice of the patient is critical in how we do business.
All right. Making every experience patient-centered is one more way MetroHealth is proving that change is healthy. My thanks to Dr. Lasky for making our experience such a good one.
To learn more, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org. Next,